My name is Tiara Wiley King. I'm a nurse practitioner here in Wilson, North Carolina. I specialize in primary care as well as wound care. I own two businesses, King's Nursing and Home Care, and we do PCS services, we do behavioral health, and we do mobile wound care. And I also own Vista V Wellness and Spa. That's like my mini Medi Spa where I do weight loss, body contouring, IV hydration by appointment only, and I usually do that in the evenings. I've been an entrepreneur since 2021 and full-time entrepreneur since last year in October. So that's a little bit about me. Oh wow. So I've always loved healthcare, like always loved healthcare. And I knew early on that I wanted to do healthcare probably like middle school. And initially I wanted to do OBGYN, and that's in my senior book. I happened to look at it the other day. And then I decided I was gonna do physician assistant, went to ECU, played around, couldn't go back. So I decided that I would do surge tech here when I got back to Wilson. I've always loved healthcare, and unfortunately we come from a family with like a whole lot of medical issues. So I've always known like heart medicine, high blood pressure medicine. That was like the topic in the house. Somebody had high blood pressure, somebody had diabetes. And then when we found out he had cancer in 1997, he had multiple myeloma, and nobody knew how to treat it. And so the nurses that I saw taking care of him, I was just like, even though I was 17, I was just like, what's going on? And I knew that they were not doing care like they should, even though I wasn't, a nurse or anything. And then I was like, if I ever became a nurse, that I would never be like that, because they were just not attentive enough to me. And so, and then when he died, that really made me want to figure out what to do and go ahead and finish it. I did really, really good in all my science courses, but I was just playing around. So, like, I did good in all the labs, but lecture is where I was making F's because I just didn't care. I didn't want to go. But I loved doing the scientific part. So then when I saw my GPA, and I still remember it was a 1.62, I have never had a GPA like that. I've always been on the A honor roll, principal list, stuff like that. So that's when I decided, when you go back home, you cannot be playing. And that's when I decided, I said, you know what, let me find something to do that's like a year. And so that's when I did surge tech here in Wilson. Started working at Pitt, which is Biden, now ECU. Worked there, went back and got my RN, and then started doing home care on the side and realized I liked my flexibility because at that time I had my son. And it's just been onward ever since. I think because they don't see me doing the physical part of nursing, that my job isn't hard. They see the CNAs, that they're the ones that's really on the floor. They are the ones that's really, involved in the patient care, hand to hand, hand on. Versus once you get to RN and NP, we don't have as much hand on, but it's more legalities. And I think that's where a lot of people are like, well, you can't be doing that much because all I see is you walking around, or I see you sitting down, or I see you documenting. What they don't see is that I'm documenting at night, that I'm documenting on the weekends, that I'm constantly thinking, is it something else I could have done for this patient? How I'm having to make critical decisions for somebody. And so it's more than me just helping them, with beds, or because I will step in and help. But I think that's a common misconception when it's the roles and the scopes. because most people see a RN or LPN, they're sitting down, they're thinking that we're just lazy, don't want to do anything, but it's a lot that we have to take care of for our scope of practice versus the people on the floor. I think it's, and especially now as a provider, it's basically taking care of everybody, making sure that, you know, has this order been completed? If I order medicines, if I order treatment, has it been done? Has it been documented? Why wasn't it done? Because I'm making sure that I'm trying to take care of this patient, but it also falls on the staff that's below. So, you know, if I ask for, especially working in a facility, you know, you're asking for labs, you're asking for this, you're asking for that, you expect it to get done. And you expect it to get done in a timely manner because you have somebody's health in your hands. And I think a lot of patients now really feel entitled, and they think that you are only for them. They don't know I have 30 other people that I'm having to take care of. You're not the sickest person. So I might not be in the room with you that long, or vice versa. All of my patients are important, but some are sicker than others. So I think it's just like now the sense of entitlement has really, really changed. We're no longer the heroes like we were in COVID. And so now it's like we can't do enough to take care of people, which is why I left bedside. A lot of times, nothing. You know, by the time you get home, you don't want to talk to anybody. My family and friends can attest to that. I would tell my mom, hey, look, I've been talking all day. I'll text you, I'll call you later. I need a moment. I used to be out in my garden. I used to be out sitting outside a lot, and becoming a provider, it has changed a lot of that because my role has changed, you know, especially owning businesses. So I'm having to make sure that these businesses are running. We have staff, you know, like I told you, the reason why I was sort of late, stuff happens all the time. And so I'm learning now to create boundaries because initially I didn't. Nurses would call 10, 11 o'clock. I wasn't on call, but they would call me because they didn't feel comfortable calling on call. And it was getting to the point my husband was like, what do they want? You know, and I'll be in the bed. I downloaded the charts on my phones. I was doing orders in the middle of the night. I mean, so it's like now you have to create boundaries, and that's something I've learned. Once my brother died and I saw how his job was so stressful, that's when I knew I was like, I have to create some boundaries. Otherwise, I'll go crazy. So now, unless it's a dire emergency, I don't answer. I don't respond to texts. People inbox me on social media. If you need help, you need to call your primary care doctor. I'm not your primary care. And I tell them that nicely. Or I might not respond, period, because I'm not obligated to. I actually just had a moment. One of my patients passed away unexpectedly, very young. And I talked about this person all the time to the point that my family felt like they knew him. And so when I found out that he died, it just was like, it affected my family, you know, because they felt like they knew this person to the point that they were like, oh my God, like what happened? Like they felt like they had to support me because, you know, this was a client that I almost felt like could be my child. It's those kinds of clients that, you know, they tell you in school you don't get close to clients, you don't, you know, that kind of thing, but you can't help it. If you're human, you know what I'm saying? Like I'm not doing this, you know, of course everybody want to make money, but I also do a whole lot more for my clients behind the scenes that people don't know. So if they don't have food or stuff like that, I would get food for them. You know, I take what I do seriously. I care about my patients. I want them to get well. I want them to heal. I give them tough love. And, and I guess that's why sometimes I wish I didn't care as much, if that makes sense. Diabetes, for sure. COPD, congestive heart failure, hypertension, for sure. Morbid obesity, amputations are on the rise because people are not taking care of themselves. They're not taking care of their diabetes. They're not taking care of their heart disease. And that's the biggest thing that, as mobile wound care that we're trying to prevent is the amputations. But we can only do so much, right? Because you're the patient. I'm coming over there to try to help you heal, and you still smoking. You still eating out every single day. You're still doing everything against what we're trying to help you do. I've learned that it's a lot of educational barriers. A lot of people do not have past 5th grade education, especially the older population. I met a lot of people that were illiterate, that could not read, that could not write. So talking to them, making sure that they understood their medicines, because a lot of people don't know what they're taking. To me, even as a provider, you need to take time to tell these people what you're taking. Do you know why you're taking this medication? Has anybody ever told you that you have A, B, C, D, E, F, G? Education for us, I feel like, is imperative, right? But you got to understand that some people are afraid to ask for second opinions. They're afraid to ask providers questions. And it's just like they have barriers of transportation. They can't get to the doctor, which is why we created a mobile wound care. They have family issues. They don't have any family. The socioeconomic issues in healthcare are real, and it's sad for insurance companies to not tell us what we need to do. We have had patients that needed certain treatments, they needed certain tests, and we would have to do a peer-to-peer review with a doctor that might haven't practiced in 20 years, that works for the insurance company, and explain to them why I prescribed or I ordered this specific treatment. That takes up time. It takes up a lot of time to try to get up with these people, explain why we did A, B, C, D, E, F, G, and they still might not approve it. I feel like people that's in these positions are not even healthcare providers. So they are CEOs, CFOs, and all they know is business. They know money. They don't know that somebody needs a cancer treatment. And yes, it costs $24,000, but why is it costing that much anyway? Why would you take somebody's money, they're paying for this policy every month, and then tell them they basically don't deserve to live? Those are the kinds of things that we see in healthcare. And then, our patients are upset. We're telling them it's not us. We have appealed, and so it's some barriers. It's a lot. Well, COVID was new. Nobody knew what to do, right? X-ray reports were not regular X-ray reports. People were dying regardless of what you did, so you didn't know what to do. But we were in the thick of it as a healthcare provider. I told you that before, if you want to piss me off, say COVID is fake. Because I had to work in it. And we didn't have the PPE that they said we did. We did have to reuse masks. We really had to depend on each other. Your teammates were basically your family. You saw these people all day long. You have your family scared because you have to go to work. We were essential workers, so I couldn't just call out unless I had COVID. So my days, I would get up, get ready regular. Then my son, I think he was in the 10th grade. So I would call and tell him I was on the way home after making rounds. And then he would open up the garage door. He would open up the kitchen door so I could come in. We had a hamper in the garage, and that's where I got undressed every day. Then he would have the bathroom door open that was like towards the garage so I can go in there and wash my hands. So we had like a routine before I could even get in the house. Then I would take a shower. At that time I might wear a wig or I might wear a bonnet, a little cap. So it's something that I could just pick back up in the garage. Every day I sprayed myself with Lysol or Microban before I got back in my car. I had a routine every day. Face was breaking out right here from the mask, but I still was wearing makeup. Yeah, and my patients, but they appreciated that because they were like, they knew it was me behind the mask. So, and they appreciated knowing that, you know, we didn't abandon them. And so, you know, it was a tough time. We were watching our patients die. Everybody was under stress. Staff were getting sick. So if you were a lazy nurse then, you couldn't be. You had to work. It was a lot of teamwork for sure. It was a lot of times that, you know, if I had a nurse in there and we were trying to flip a patient, we were trying to do all of this, you know, it was always a joint effort because we just had each other. Times have changed. People that go to nursing school now, and like I can get on that soapbox, you know, they there to wear cute scrubs, and you ask them a question, they like you asked them for a kidney, you know, so yeah. Especially now that I'm older and I see younger people so sick, it really makes me take my health for granted a little bit more. People are living older longer, but they're sicker. And then we have people that are younger than me that are very, very sick. And especially when I see younger people, it does hurt my feelings because I'm like, what happened? You know, were you born this way? Was this a lifestyle choice? You know, a lot of mental health comes from drugs. It makes you look at life a whole lot differently. You might be complaining about something, and then I go to a patient house and I'm like, I need to shut up.
You mentioned earlier about losing your brother, which condolences.
That's when I realized that you are a number. You are a warm body, and they will use you to your fullest capacity. And they wanted me to come back to work after we took him off life support. And my medical director at the time, she even told me that she told him, how do you feel that she's gonna be able to take care of patients, you know? And they were like, well, we don't have anybody to cover. I had to have surgery, and because I couldn't make rounds, they fired me. Like ever since then, that's when I knew I couldn't work for anybody else. Because people, they don't care. One health issue, high blood pressure. They call it the silent killer because you might have a headache at one time and your blood pressure is 200 over 120. That's stroke level. You might end up having chest pains and you just be like, oh, that's probably nothing. And a lot of times I find out people have high blood pressure when they couldn't have Vista B. Because I do their vitals. If they want any medications from me, have you had any labs? Who's your primary care doctor? What about your blood pressure? What's your family history? I do all of that. And That's how I have diagnosed a lot of people with high blood pressure, because they came to me. And then you need to get a primary care doctor, because I can't follow you. So I have had to prescribe short-term meds for people because I couldn't let them leave my office like that. High blood pressure is deadly. It can kill your vision, it can kill your kidneys, stroke, it can kill you. And a lot of people like to blame it on pain, and pain can increase your blood pressure. But after several blood pressure readings, if it's still elevated, then we need to figure something out. But then here come the socioeconomics. Do they have a ride? Do they have insurance? Everybody doesn't qualify for Medicaid. How they gonna pay to go to the doctor? Those barriers pop. Another thing with the insurance is with Medicare, if you don't get traditional Medicare, then you also raise the risk of not being able to get your stuff, because supplements might not pay for everything like traditional. So it's important for the older people to understand what Medicares they're signing up for, because some Medicare won't pay for this, some Medicare won't pay for this. And so my mom is 75, so we made sure that her stuff is taken care of. But everybody doesn't have health care professionals in the family. They also don't have an advocate in the family. So once again, socioeconomics. It's a vulnerable population, and that's what we deal with in Eastern North Carolina. A lot of minority patients, a lot of older patients. And if you have a low literacy level, you have no idea what's going on. I would say go and get your blood pressure checked, for sure. I'm a part of Black Nurses Rock, and so a lot of times, I haven't had a chance to be with them a lot, but I did speak for Rainbow Tea. They offer a lot of stuff at the end of the month. They'll be at Walgreens, and I think they'll be doing blood pressure checks, they'll be doing HIV checks and stuff like that. Checking with them, checking with OIC. My goal is to start doing more community health stuff from our home care perspective, because that's where I found out a lot is going on health-wise with patients when I go out and do visits, because some patients don't know what to ask. But my biggest thing is getting your blood pressure checked. I really have become more spiritual lately. My mom sends us scriptures every morning. I try to listen to those, try to read those, read affirmations and stuff. I started back doing yoga, and just knowing that I could have it a whole lot worse, and to stop complaining about what I don't have and to be grateful, because it's a lot of people that, even when I feel like I'm at my lowest, people still look at me and say, I wish I could do what you do, when they don't even know what I'm going through personally. Just getting more spiritual, getting more active, taking care of my health now. And just realizing that it's okay not to be okay. I can't be everything for everybody. I'm usually the family go-to, and sometimes I have to say no. And those boundaries now, my mom tells me all the time, you can't be superwoman. I said, well, then y'all need to start asking me for everything. And just creating more boundaries, even with family, and making more time for yourself. I was learning how to play piano a year ago, and so a lot of people don't like to teach adults. So it's been hard for me to try to find somebody to learn again. But that's one of the things that I want to do, because those Tuesday nights, I look forward to them every Tuesday. That's my next goal, is to find me another instructor. Let's look at the whole person, because it's a reason why something is going on. Like I said, literacy, or lack of, no familiar support, no caregivers. They need to have somebody that actually comes in, that actually cares about them, that's not doing the work just because they don't have anything else to do. You want a caregiver that cares about what they're doing, that's going to take care of these patients, that are going to report if something's wrong, if something's happening. And you just want people to actually care and not just come in there so they can get paid. Even though it may look glamorous, it's hard as hell. You know, it's like, I love what I do. Love taking care of my patients. I love my staff. I want to treat my staff better than I've been treated as a staff member. We wanted to bring the family back to our organization. And I just want people to understand that it's more to being an NP or RN. It's more to that title than just that title. I feel like you need to really own that title so you can show people that you care about them and not just walk around with your name on a white coat. Because that was my goal. I want all these initials. I want all this stuff. I wanted my white coat, yada, yada, yada. But now I see the responsibilities that come with that coat. Yeah.